Okay, so I'd like to welcome Bethany Cutts, and her presentation is Shifting Terrains, Society, Nature, and Hazard Information for Fair-Minded Transdisciplinary Impact. Thank you, Bethany.
Hi, thank you all for being here today after lunch. I'm going to talk a little bit today about a project that came about because we were invested in community in the Robeson County area. So after Hurricane Matthew, which is just about the time I moved to North Carolina, some other researchers put me in contact and said, you know, there's a lot of good work going on here concerning recovery, and I think your community voice approach might be really well matched with the capacity and interest in the community. And community voice is a framework where you don't really come in with strong research questions from the beginning. You come in with the option of learning. So as a social scientist and just generally curious person, I really like that as a way to think about how to go from use-inspired research to useful research. So we started then setting up a team with a community advisory board and working to hire community assistants who would be hourly employees living and working in our study region, able to do a lot of the day-to-day follow-up that we just couldn't practically do from North Carolina. And what came out of that was a couple of real opportunities. The first opportunity was to know a little bit about what community needs were already being met by scientists active in the area. So as you can imagine, after Hurricane Matthew, in 2016, there was a lot of scientific investment in understanding changes in many issues relevant to this crowd in terms of catastrophic flooding, new mixtures and emerging mixtures of hazards and contaminants and their influences on communities overall. What we found was a lot of interest in one thing that wasn't being as actively addressed as the floodwaters themselves or potential contaminants in drinking water, and that was residential soils. Now, coming from my previous research, I knew just enough as a social scientist to be dangerous, and that I needed to find collaborators with more knowledge about soils. So the social I had the team, I had the community liaisons on the ground ready to collect data the community has expressed an interest in. NC State researchers more broadly had the expertise, and making this fair-minded and transdisciplinary connection was really something we had the capacity to do because of that legwork. So the dilemma in disaster scholarship in general, right, is that disaster scholarship is important. We need to know what's happening directly after some sort of catastrophic event. But that relies oftentimes on critical and time-sensitive information. So we need to get there relatively quickly because people's perceptions change, because ecosystems change, and because the dynamics of the world and funding move on. In order to set ourselves up for a good long-term recovery, we need an appropriate and scientific evidence to inform that effort. But how do we do that when that scientific data collection ultimately is going to have long-term benefit, probably more globally in terms of policy implementation, and most likely in the community itself over the long term, but may rely on a lot of time and energy from survivors in the short term? Now, this is especially concerning when we think about the poignancy of disaster inequality and of the tendency for catastrophic events to unevenly affect humanity. So we have all sorts of social vulnerabilities that make people more likely to experience sensitivities to disaster in the first place, and to be more likely to recover from a position of disadvantage. These concerns are especially acute when we think about racial and ethnic diversity, gender diversity, and rural areas, as our disaster framework, as implemented by the federal government, states, etc., tends to focus primarily on dominant cultures, middle to higher income areas of high economic prosperity, and in more rural, urban centers where we have higher population densities. So that leads disaster scholarship to the place of questioning how we can better support equity and resilience as a policy imperative and a norm at many different levels, and also as an active area of scholarship in terms of understanding how policy gets implemented and to what ultimate impact. So is science implemented fairly is one of the driving questions for this work. We know that solid soils is a knowledge gap. It's not only a knowledge gap in areas of North Carolina, in Robeson County, where we were studying, but it's a general area of under-research in the disasters literature. So we know that soils change during catastrophic flooding, and that during flood disasters, the mass transport of soils and sediments has the potential to distribute contaminants and present novel combinations in residential and other areas. But residential areas, in comparison to others, are much less well researched, leaving the question, when is it safe to go back outside, as one that's not really well understood. We know that these soils change, but we need more ecological data in order to understand how concentrations and combinations come to remix. So are there, for instance, time horizons that are especially important to bacterial pollution in terms of its acute risk the acute risks of exposure associated with gastrointestinal disease or disorders and diarrhea? Is there any influence of more long-term chronic exposure? And does this have anything to do with upstream land uses? How long does it last is a question that's not fully understood. Heavy metals as well. So we know a lot about metals like lead being neurotoxins, even at low levels, but to what extent do upstream industrial contributions to lead, cadmium, heavy metals make a difference and create new hazards in residential areas where you might not expect high hazard loads due to really close by land uses? And then finally, what other risks might there be? Are there molds or other secondary contaminants or health risks that are due to either new combinations or new concentrations of bacteria and heavy metals in soil? So there's a clear need to advance ecological knowledge in each of these domains, as well as to understand how these known contaminants change as we bring in new and emerging pollutants and opportunities for microbial resistant. This is the area that's just outside my area of expertise. I want to say MRSA. Microbial resistant infections, and I'll think of the word later. So we also need to know need to know more about the social system, not only the social system where disasters are being experienced, but also the social systems of science, right? So social data is needed to understand where we have data and where we don't, and whether that misrecognizes or misrepresents different risks. And one example that's become somewhat of a classic is Hurricane Katrina. In the aftermath of Hurricane Katrina in New Orleans, we saw large amounts of flooding in residential areas nearby industrial land uses that were home to lots of potentially hazardous contaminants and pollutants. We saw neighborhood concern about children playing in areas that, as for example, this quote that children were playing in areas that have toxic sediment and where the wind blows, and it's not what any of us like to see. So this toxic gumbo induced a million gallon petrochemical spill flooded the city and contaminated soil with a range of pollutants, including arsenic, diesel fuel, and benzylpyrene, in addition to any contaminants that were there before. At the same time, the Environmental Protection Agency did extensive testing and ultimately declared large regions of the city safe using only testing sites that were on public property. So this, as Frickel and Vincent, two sociologists, wrote, led to science being undone, that there was an undersampling or undersurvey of private areas of residential neighborhoods and places where people were living, working, and playing that left residents with incomplete information on the potential exposure risk from their homes and yards. It was an opportunity for new sampling and new ways of doing science with communities instead of to them or for them. So building on these knowledges, our team advanced a social ecological hazard investigation. This shows Talik Carly McCrae, one of the undergraduate students and a Robeson County resident who was on our project, Angela Allen, a Spanish-speaking local community partner who had been active in community organizing in different ways, and Laura Bray, a sociology PhD student here at NC State. Each of these roles was instrumental in a recruitment approach that invited people to participate in research as they saw fit. So they could choose to participate in soil testing alone for either E. coli, heavy metals, or both. And if they also wanted, they could participate in interviews, allowing us to understand the context of this ecological testing and set the stage for more culturally responsive opportunities to return our results to the community. It was a high priority to neither overestimate or underestimate the relevance and importance of these soil results to community context. In the course of about 18 months, we were able to get 90 residents to participate from across Robeson County. Of these 90 residences, 97% participated in E. coli testing, 52% participated in heavy metal testing, and 53% participated in interviews. And you can sort of see the breakdown in various combinations of participation on the weird donut on the right. I think it's on your right. It could be on your left. Overall, when we look at E. coli, we can't precisely or definitively tie bacterial concentrations in the soil to the flood itself. We did see, and there is no Environmental Protection Agency regulatory threshold for E. coli as an indicator of bacteria pollution. So what we found was that in 52% of samples, there was some detectable levels of E. coli, and the range varied substantially from 3.59 most probable numbers per gram of soil. So that's about how many you would expect to find in a gram of soil, to 1,115. To present these data, we also and give a relative scale. We compared it to the literature, where we found these numbers to be quite similar to areas in Tanzania with known sanitation infrastructure limitations, and also quite similar to the range of variation we found on the NC State campus, an area that did not flood in recent hurricanes. This pointed out a social need to really understand the range of variability in E. coli and how to appropriately communicate this when we tend to see more testing in areas where we suspect a problem. When we looked at heavy metals, we found most of the samples above the lower detection threshold of the testing protocols we implemented, but no no levels that were higher than thresholds of concern listed by the Environmental Protection Agency for residential areas where children would be playing and potentially ingesting soil. So relative to these standards, this suggests relatively low potential exposure risks from residential soils in comparison to other ways of experiencing environmental hazard and harm. Interviews and field notes really helped to unpack and understand this context. And we found a number of people talking about more than the soil hazard, although the soil was the primary reason we were there. And thinking about this in a multi-generational way, and in relation to very important distinctions between risks they perceived as to and from nature alone, instead of permeating a boundary they perceive between society and nature. And then finally, we saw concern for appropriate levels of mitigation. These interviews and field notes showed that far and away, flood and mold were perceived as prevalent risks that were highly perceivable because of tactile cues, where drinking water could switch back and forth between a perceived and imperceived risk, depending on public information and alerts, and wildlife changes and soil were fairly distinctly non-human risks in the estimation of our interview participants. This indicated lots of opportunities to rethink communication with communities by thinking about whether or not society, the public, the survivors of disaster were thinking with rigid or more flexible society nature boundaries. We could better estimate whether information alone was likely to be empowering and actionable, or whether a larger information set was needed. In the case of soil, in the case of this particular study, a larger information set really was needed. And to accommodate this at our sessions with community, we made sure to highlight results and studies focused on other elements of hazard and risk. This included our website, which you can see here, and really highlights the opportunity and value of thinking both socially and ecologically in post-disaster research, to combine those methods to listen to and respond to community needs, and to think about fair-mindedness and communicating not only with individual participants, but with communities at large. All right.
So we're going to save the questions. All right, we have Hannah Tuckman next. And get this playing. There we go. And Hannah will be talking about the use of mobile and social media data to improve disaster management. Thank you.
Hi, everyone. I'm Hannah Tuckman with the UNC Water Institute. I apologize in advance if you can't read some of the stuff because it looks like my slides might have moved when they switched it over to PowerPoint, but we'll work through it. So I'm talking about social media mobile phone data in disaster management and the implications that that has on vulnerable populations. So first, I want to look at an example of Hurricane Dorian and how it hit South Carolina. South Carolina Emergency Management utilized their Twitter and their Facebook to spread messaging both before the hurricane and during it about like weather updates. And this worked well because news outlets knew which social media messaging to follow, and they knew the credibility of that information. Where South Carolina Emergency Management ran into some issues where when it came to private citizens would then tweet at the emergency managers and be like, this is my situation, I need help. And the local officials didn't know who had actually received that information and if like telecommunications had already received that. So there was a sense of confusion that happened, and South Carolina Emergency Management didn't have the capacity beforehand to sort of help with the influx of volume that they would have through this new social media messaging. So I see a really interesting opportunity here for improved disaster response because of these three factors. So new ways of collecting data and data mining techniques have been revolutionizing every sector of society, and emergency management is not an exception to this. We live in an age of big data, and there's an opportunity for transformative change in disaster management because our decisions can be made due to this influx of data. And as a society, we are transitioning from an era of data scarcity to an era of data abundance. And you can even see this in lower and middle income countries where we're now able to gain data in areas that were otherwise we knew relatively little about. And then this is also coupled with climate change, which is increasing both the frequency and intensity of natural disasters. Currently, the annual number of people killed from natural disasters is around 60,000, and that is expected to rise due to climate change. And then also add this with now there's a focus on a shift to a social perspective to disaster management. The Sendai framework for disaster management is beginning to emphasize this social perspective. And social media and mobile data will allow citizens to actually be in the forefront of disaster management decision making. So I wanted to go over quickly 3 types of data. The first type of data is directed data, and that's human operator focused data capturing technology on a person or place. So when you think of that, you think of traditional surveillance data, cameras, and remote sensing. Automated data is collectively or passively sort of collected through the normal operations of a system. You can think of mobile phone use like call records, web searches, and credit card use. And then lastly, you have volunteer data, and that's data that's actively or passively produced by citizens. And so that's when we're looking at crowdsourcing data and social media data, which we are finding to be very rich because it can tell you a lot of information beyond just an individual level. So now I want to look at a couple different uses of social media and mobile phone data in disasters. So this is during Hurricane Harvey. The picture to the right was tweeted by a man named Tiffany McIntosh that lived in Florida. And this is the first time that we're able to see social media being used due to an overrun 911 system. So citizens were turning to Twitter to reach out for help because they couldn't get in contact with traditional telecommunications. So this picture was tweeted, and then after I think it was about 2,000 likes and many retweets, and you can see a retweet over there. The emergency management officials began evacuating these 18 people in this nursing home. And after every 30 minutes, the emergency officials were tweeting at Timothy McIntosh or privately messaging him, letting him know about the status updates with this nursing home. But there is a concern of who's using Twitter to reach out in emergencies. And in some studies, there is a concern that the Twitter users are typically white, male, more educated, and living in urban areas. So there's a conversation of who's getting left out through using this means. So I want to look at open source two-way SMS data. And here there's two different platforms that are used that I'll talk about. And so frontline SMS, what is interesting about that is it doesn't need a lot. You don't need a lot to get started. All you need is power and internet, a computer that can be used for a hub, a SIM card, and then their free software. And it's able to turn a laptop into a central communication hub to facilitate messaging. And it relies on a text messaging service, which is good because that's easier and more accessible. And then in a pilot, Frontline SMS partnered with Strengthening Participatory Organization in Pakistan following monsoon flooding. And so they use it to both receive and send messages about complaints and responses after this and request for help. But there had to be a effort to happen before where volunteers were going out to the communities and explaining how they wanted them to use this number to text. And as well as they also received information from the individuals with their names and their contact information and their addresses and sort of things like that. So then when these individuals messaged this number, it would pop up information about them and sort of better help the response when they would send responders out to those areas. And something that was interesting about this was that it was in Arabic. Originally, the messages were sent, but then it was able to be converted into a numbering system. So it was easier to categorize. And then Rapid Pro SMS is actually something that came out of UNICEF, but it was originally used for faster delivery of blood sample testing, but it's turned into this flexible and like customizable software that can be used. And you see it a lot in like education systems, but there's applicability for disaster response. It's used for early flood warning systems to send audio messages in Cambodia. And they decided to use the audio messages because of literacy challenges in the area. But currently that program covers over 200,000 households. So now I'm going to look into crowdsourcing data. So these are two different projects that are interrelated. The first one is Mission 4636, and this is a number that people could use where they would just basically report something that they saw. And it was used during a 2010 earthquake in Haiti. People would text this number. That information would then be translated, categorized, geolocated, and then you could extract this like missing person information so responders knew where to go. But an issue that they had with it was that it was a one-way system. And so they would say that they needed help, but there was no way of knowing when this aid would actually come or how the message was being received, or if the responders needed more information, they couldn't text back that number and get that extra information that they needed. So then you see this Ushahidi project, and that originally began as a result of violent incidents following a Kenyan presidential election, but now it's been applied for natural disaster response. And it's where volunteers will put SMS data, emails, and web-based submissions onto a map for the general public to actually see what incidents are happening in their area. And they can click there for more information, as well as it would be used to sort of coordinate with responders to go to those specific areas. But something that they ran into a problem with this was that after citizens would then send the information, it would be translated and posted in English, and the populations that they were trying to serve didn't speak English. So there was a big like gap in who could actually use it. And the people that were sending out the messages couldn't even understand their own messages that they put onto this platform. But something that is cool about it is that the Ushahidi map can also scrub Facebook and Twitter, so they could automatically put tweets and Facebook posts onto the map to see those as well. And from that, they came out with 5 sort of key traits that made this technology possible, or this platform possible, and that it was that the technology was simple. It is accessible in areas that had low connectivity. It was accessible with many different platforms so that you could use like phone or your laptop. There's an emphasis on the verification of information, and then the mixed funding sources, they said, helped it be successful. So then I want to now talk about the implications that these different platforms have for vulnerable populations. And to begin, I wanted to go over FEMA's definition of vulnerable populations because there's so many different definitions, but FEMA defines vulnerable populations as a population whose members may have additional needs before, during, and after an incident in functional areas, including but not limited to maintaining independence, communication, transportation, supervision, and medical care. Individuals in need of additional response assistance may include those who have disabilities, who are from diverse cultures, who have limited English proficiency, who are non-English speaking, and who are transportation disadvantaged. So this is a very broad definition. And I think it's a useful one to use here because all of these populations that are listed would be affected by using these different platforms. And then there's also the ADA toolkit. Chapter 7 of that is about emergencies and disasters. And under there, there's a requirement that officials make notification systems accessible to people with disabilities. And I think that there is an opportunity to sort of link these sort of platforms of open communication, not just notification systems, to be under that sort of same guidance. And so if you look at the considerations, one thing that's really important that I wanted to touch on is the lack of trust that you have in some of these populations, just sort of from these historical patterns where their trust has been violated. A lot of vulnerable populations do have a lack of trust in emergency officials. And that could be exacerbated by using social media because there's a lot of misinformation out there. Also, there's the question of who, as I said earlier, who is using this, who are using these platforms and who has access to it, which leads into those literacy and access challenges, which could also lead to an underrepresentation of vulnerable communities in your work. And through a study, they looked at who it is that actually tweets in disasters, and it showed that it's good for the people that are physically vulnerable, so who are actually like in the path of the disaster, but not necessarily good for the socially vulnerable. And so by doing these different like platforms and methods of using data in your response, it could create a widening gap in care. So just a couple key takeaways is that if you're gonna use social media, just understand that Twitter and any social media isn't a neutral platform and it doesn't represent the whole population. Public education needs to be used before a disaster on a sunny day to teach people how you want them to interact with the platform or different tools that you're trying to use. And then you also have to make sure you have the capacity and staff capable to handle it. Because if you're getting this like max influx of volume of messaging that you can't handle, you will then violate that trust that is really delicate in this field of work. And then lastly, you can't just rely on any of the things that I like just explained. You can't rely on at all, because if there's electricity grid, all of them are dependent on that. So if that electricity grid is taken down and you were only relying on these tools, then you would be creating a larger vulnerability for yourself. That's all. Thank you.
We have plenty of time for questions. If anyone has any questions for Hannah.
Thank you, Hannah. That was great. So you might have covered this in the beginning and maybe I just didn't absorb it. How is the data cross-referenced wherever it's used? I mean, you give examples where they don't necessarily have 911, but how would it be used in sort of collaboration with what exists now, the 911 emergency line, right? So like if you're giving a community another way to contact, through Twitter or something like that, what if they're doing Twitter and 911 calls?
Yeah.
Part of me is like, we have 911, right? Like that's our emergency system, right? So I understand that making a phone call isn't always going to be the best or, most accessible way, but that system is so established that I envision it being clusterly challenging with any additional input on the emergency team.
Yeah, that's something that like I think through too. And a part of this is more like looking globally, like what different technology has been used, but that's definitely a concern. But these could also be things that don't necessarily require 911, like direct emergencies, but things that like need to be fixed or things that have more time. Because like there are people that call 911 for like life-threatening emergencies. But you would have to include that system already into what you have and look at, if you want to build something, how you would loop in telecommunications to that. But you also, at the same time, you don't want an influx in 911 of things that aren't truly life-threatening emergencies. And so this would also give another place for that information to be sent. But you would have to, as I was talking about, like the sunny day efforts, that would have to be included in this process to sort of educate people on what sort of information you do want to gather.
Yeah, great, thank you.
Yeah, thank you.
Hi, this is Al Sweet from WSP Engineering Company. So I'm not sure if the SMS using cellular like cells, towers, or is it, using Wi-Fi? So did you explore, some application like WhatsApp? The second question is, have you also explored NC Ready? And this is an app, for hurricane, by North Carolina.
Yes. So I have looked at both of those. I just picked a couple examples for this. So like to back up, this project is like in the very, very early stages. And right now we're just looking at different uses. And I just picked out a couple for this. But some of the web-based platforms that you can use for messaging, like WhatsApp, have been used and have been successful. But the SMS ones that I was speaking to specifically use cell towers currently. But yeah, those are all things to look into, and they will be included in the longer term project. But this is what I'm working on now. This is just like the very initial stages of something that will turn into something bigger down the road.
we still have time. There's other questions for Hannah.
Thanks. I was intrigued by your noticing, I guess, kind of the limitations for, I don't want to say disabilities, well, in some cases disabilities, right? There may be visually impaired, hearing impaired, but there's also, you know, the literacy component and the language component that you mentioned. So, and where you said your early stages, you may not have gotten there yet, but have there been proposals for solutions to overcome, you know, some of those? And it's interesting to me that it went out in one language, came back in another, and so that translation got lost. So
Yeah, I agree. Even like that translation was something I wasn't thinking about before, but and the message about like the Cambodia early flood warning and how they send out audio messages, there's things like that that are used to combat those challenges. And you don't think of people that like don't have a phone as being like traditionally thought of as vulnerable, but in this sense they are. So you really have to take that like broad vulnerability approach to this research if you want to actually like capture everyone in what you're doing.
I have a question. So looking at the different, you looked at social media, you looked at apps, and I was wondering like who instigated or enabled the apps that were created. So I saw maybe some foundations had paid for them. Was that how those came about, and how do those come about, I guess?
Yeah, mostly they're nonprofits from what I've seen that have created, and then they would like partner with governments to sort of also like get funding for it. But most of the time it's nonprofits. I did work in a company in Israel, and it was a for-profit company that did similar work. And they like made their money through working with different companies. Like they work with like Verizon, but then they would have applicability for like general public, and they would just use the funds that they used for those like for-profit projects for the greater good, like public instances.
Time for one more, if there's any others. Oh, Bethany.
Hi, thank you so much for this presentation. I had a question about kind of where you see this going. Because in some work I know Anne has done and I have done also, there is such a rich environment of information around disaster, specifically in response and then later in recovery. So which space are you headed into?
That's honestly like a great question. It started like this project originally started out. Well, let me go back to like who Re-Energize is. And so it's a funded project through like a Belmont Forum funded project. So they want to like really try to keep their focus really like global. And so, but it did start as like how our question was how you can use social media to help the vulnerable populations. And then we're like, after looking into it, we're like, okay, we need to step back and understand like what's currently happening and how is that affecting those populations. And so that's the stage that we're at now, is like more taking a step back and then figuring out where we want to go with it. But at the end stage, we want to come up with like a deliverable to this. My funding comes like through the UN. So it's like something to influence them. So you have to think kind of globally and sort of have this like wider audience. So it's really just like the next step will be working with responders or like emergency management officials on like various different levels to get like input on what like they see as a need, and then let that guide where it goes from here.
Thank you.
Thank you.